Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department. Let's talk about this pandemic. In this video, we continue the series on why even consider vaccination. So please share this with someone you care about. During a recent focus group, a young woman made the comment, "If nothing is going to change and I haven't gotten sick, why would I get a vaccine?" In other words, why take any risk, no matter how small, if there's no benefit? Makes perfect sense, except it's based on a common tendency we as people have. Her premise is that nothing is going to change, and that her belief is the only possible outcome. That is the inevitability trap, the tendency to latch onto a possible outcome as the only outcome possible. So let's take a look at what nothing is going to change actually means in the context of this COVID virus. Right now, the recommendation is that public health protective measures should continue even for people fully vaccinated. Nothing changes, right? Avoiding crowds, keeping distance, limiting time around others, face coverings, hand washing. So if vaccination doesn't change this, why bother? But this confuses the two benefits of vaccination. Number one, the advantage for an individual, and number two, the advantage each person gives to the community. The data, and now our experience, makes it pretty clear that vaccination is a benefit for the person vaccinated. Less risk of serious illness, less risk of long COVID, less hospitalization, less death, no quarantine needed for a fully vaccinated person if they get exposed. That means no missed days of school or work if exposed. Of course, these benefits must be compared against the risk of the vaccination. And for more about how to do that, see the first in this series about assessing relative risk. So that is the benefit to an individual. But the other benefit is to others and to the community. So right now, it's safe to gather with other fully vaccinated people. How many you can gather with depends on community spread. The less the virus is around, the more you can gather with others. And as time goes by, that number will change. So think about larger gatherings like movies, music, plays, festivals, weddings, funerals. All become safe as more people become vaccinated, and that opens the economy for the better. A big concern is the risk from variants, virus that mutates into something harder to deal with. Mutations only occur when the virus reproduces itself, when it replicates. Fewer people infected equals less new virus replicating. That means fewer mutations. That equals less spread. The main point here is that more people vaccinated means less risk of mutations, and the sooner we can dismiss with the public health protective measures. But there's more here. Just because she hasn't gotten sick doesn't mean she can't or won't. Today in Haywood County, 13 people got sick from COVID. In North Carolina today, 20 people have lost their lives from COVID. It is not inevitable that nothing will change for her, and believing so keeps her from being able to see that things can certainly change, and she, as well as each of us, has a critical role to play in that change being safe for her and for everyone around her. You know, here's my buddy. We're not having to wear a mask. He's been vaccinated, I've been vaccinated. That's a change. So be well and be careful, especially right now.